Morning. I'm Dr. Saeed Tajuddin, lecturer in pathology, Mahi Institute of Dental Sciences. So we are discussing cardiac diseases today. Moving on to the first slide. So this is the normal anatomy of heart. You can see a right atrium opening into the right ventricle. The venous drainage superior vena cava and inferior vena cava collecting blood from all the venous circulation draining into the right atrium, from there to the right ventricle, and the blood is taken from the right ventricle by the pulmonary arteries to lungs for oxygenation. After oxygenation, the oxygenated blood is carried by the pulmonary veins, which is taken into the left atrium, that reaches the left ventricle, and then the blood is taken by the aorta into the arterial circulation and to the other organs. And here we can also see a conducting system of heart, which starts from the SA node, which is on the posterior aspect of the left atrium. From there, the impulses are transmitted to the AV nodes. That is seen in the area of the mitral valve, sorry, in the tricuspid valve. And from there, AV nodes, then it is transmitted to the bundle of his, and from there to the myocardium. So this is the conducting part of the heart. And we also have the layers, the inner chamber, the chambers or the inner lining of the heart is called endocardium, and the muscle layer which forms the bulk of the heart is formed by myocardium, and we have an outer covering also which is called pericardium. So there are three layers. One is pericardium, the outer part, myocardium which forms the bulk or the muscle layer, that is myocardium, and the inner lining is called the endocardium. With these we can divide the diseases according to the anatomical region as well as depending on the functional impairment. So we have heart failures, congenital heart diseases, ischemic heart diseases, hypertensive diseases, core pulmonary, rheumatic heart diseases, endocarditis, valvular diseases, myocardial, pericardial, and tumors. So discussing the first one, heart failure. So heart failure is the failure of the function of the heart. So it could be a right-sided heart failure or a left-sided heart failure. So right-sided heart failure, so that results in the pooling of peripheral blood or the venous blood that is reaching the heart is pooled there. So that results in a pulmonary hypertension or residual blood in the right part of the heart that increases pressure in the pulmonary venous circulation, and which is transmitted to the arterial circulation that results in pulmonary arterial hypertension and a failure of the right side. So that results in systemic venous congestion and peripheral edema. Coming to the left heart failure, the causes are ischemic heart diseases, myocarditis, valvular heart diseases, and respiratory pericarditis. So that results in a failure of the arterial supply. So if the arterial supply is altered, that decreases the cardiac output, which results in tissue anoxia or hypoxia, and that can result in ischemia as well. And this is sensed by a decreased renal perfusion. So if there is a decreased renal perfusion, that is detected by the RAS system or renin-angiotensin-aldosterone system, which tries to correct by uh, retention of sodium and water. So if it is not corrected or the RAS system doesn't work, so the renal perfusion is decreased, that results in renal ischemia. All the major organs undergoes infarction or ischemia, and that also results in a congestion or cardiac death, sudden death. So left heart failure can be acute and can result in a sudden death, whereas right heart failure results in systemic venous congestion and peripheral edema, and it also results in pulmonary failure. So that is called core pulmonary. If right heart fails along with a pulmonary dysfunction, that is called core pulmonary. So we have two types of heart failure: right heart failure and left heart failure. Right heart failure results in systemic venous congestion and peripheral edema, which is due to the right-sided valvular diseases or right-sided myocardial disease. It can also occur as a result of a left heart failure. Left heart failure is due to ischemic heart diseases or myocardial diseases, and this results in sudden death, shock, decreased cardiac output, etc. Right heart failure along with the pulmonary dysfunction is called core pulmonary. So coming to the next heading, congenital heart diseases. So we can divide the congenital heart diseases to three types. One is the malposition of heart, that is the dextro rotation of the heart. Heart is normally present on the left side, sometimes it can be seen on the right side as well. So second is shunts, that is the normal blood flow in the heart is deranged. If there is a passage of blood from left to right, it is called a cyanotic group or a late cyanotic group. And if blood flows from the right to left, this is called cyanotic. So examples are left to right shunt, ventricular septal defect, atrial septal defect, patent ductus arteriosus. Right to left shunt is cyanotic heart diseases. The examples are tetralogy of Fallot, transposition of great arteries, persistent ductus arteriosus. Third one is obstructions. Examples are coagulation of aorta, aortic stenosis, atresia, and pulmonary stenosis.